Hello everyone. This video has been created to give you the demonstration of our DS4u EMR system. The purpose of this video is to give you a complete understanding and idea of how DS4u EMR system actually works. It is a digital version of paper chart that contains patient medical history and all billing related information. It is beneficial because through this you can track data over time. There will be very fewer errors, hence patient safety will improve. You can maintain all records of patient billing, therefore billing will get easier. You will have easy access to clinical data. Well, as we have already talked about the benefits of this EMR system, now we are going to have a walkthrough of it. As you have already created the entities within this system, like provider and receptionist, so what I'm going to do is I'm going to have directly account access of receptionist so that we can get an idea that how a receptionist will be interacting with the system when a patient log into it. So as you see, this is the dashboard of receptionist interface. Here you will be able to see the complete list of appointments that has been submitted by the receptionist or the provider or the other staff member who has been added by the doctor himself. You can see here like the appointment time, whether it's individual appointment or a group appointment. You can also have its clinician name and the patient name, schedule date, current status of this appointment, like whether the patient has still means yes yet. You can have current status of the appointment, like whether the patient has yet checked in into your hospital or clinic or not, and you can update it like checkout. And then we have the vital and allergies thing, and then we have a vitals and allergies feature to add all of the necessary vitals and allergies informations of a patient into this. From here you will be able to add the different statistics of a patient. So this is the first screen you see after logging into with receptionist account. Here the complete list of appointments will be displayed with the with the search option, and like you can have the list within the list view and the calendar view, and then you can have a appointment type like whether it's individual or a group appointment. Then you can have a clinician name against it and the patient name who has booked the appointment and the scheduled date of appointment. And then we have the current status like checked in and checked out, and other options we also have it. So and then the vitals and allergies. Here as a receptionist you will be able to add different vital stats of a patient who actually enters into your hospital or clinic, like you can add his weight, height, blood group, body temperature, heart rate, onset date. This is the all vital that you can add for a particular patient. And then the allergies information, that from what thing the patient is allergic to, and a chief complaint, and that's it. These are the information that will be necessary for the doctor or provider to get the patient treated for a particular um, you can say for a particular disease. So these are basically the information which will be inputted by the receptionist only. Well, if a receptionist wants, then she or he can add a new appointment, that if a patient has newly arrived into your hospital or clinic, or a patient has already been registered into your system but he is visiting it, then you can add the appointment for the particular doctor by this screen. You just need to select the date and set up the appointment for a clinician and the type of it and the scheduled date and description. So here we have the option of charting. You can view or add or input all of the information of a patient in the charting. Like we have different information here, like face, sheet, notes, reports, clinician, accounts, history, allergies, medications, checkout, and previous visits. In the face sheet, you will have different options to view. It's just demographical information for this patient, like medical history, surgical history, and this. And then we have notes. Here you will be able to see the complete list of notes that has been provided by either you or the provider. You can have a customized note. You can add a new note if you need it. So you can add a new note if it's required. And then we have the option for report. You can add a new document. You can download any of the reports that has been attached for this patient. And then we have the clinicians history. These are the list of all the clinicians from which the patient has taken the medication or treatment in his past. And then we have the accounts. Here all of the account details of this patient will be stored. Basically, it's just a credit card details that we are asking for. And then we have the history. History will be like medical history, surgical history, social history, lab and orders, immunization. That is related to patient only. Like all of the questionnaire that we need to ask patient before we admit it into our hospice. And the allergies, it's same as we have seen in the vitals and allergies. These are the medications. And the checkout is just like a in the charge entry sheet that we create for a patient when he check out. So we can here like add a new charge entry by just selecting the appointment date, and then we can apply charges for that particular appointment. So here you can see the complete form and information that we need to fill for that appointment. Like we can select the diagnosis code from here. You can apply the charges from here. You can add services that has been given to the patient and the patient name. So this is the charge entry sheet that we need to fill for creating that um, charge entry. And so here in the previous list, in the previous visit, so here in the previous visit, you can view the complete list of all of the past appointments that has been booked for that particular patient. Then we have the scheduling part. It's similar to the appointment part that we have seen on the dashboard, but it's like dashboard was just the overview of it. Now from here is just a separate module where you can create the schedule and appointment for the patient. And we have the patient list now. Here you can search a patient by his name and the HIPAA agreement if he has considered it or not. And then we can search it, and then we can add a new patient if it's required. You can register it from here. You just need to provide the basic demographics details for the patient, then the contact information. Well, you cannot proceed to next step until unless you fill it. You fill the first step information. So so we have selected the past patient who has already registered in it. So these are the basic information that is required for a patient, and the contact information and the background information and the insurance details. Well, there is a point, if a patient is not, associated with any insurance, that you won't be able to create a charge entry for it. So if you need to create a charge entry, then the patient must be, connected or associated with that particular insurance, so that we can proceed with the claim process. Then we have the charting, similar to the dashboard which we have seen. And then we have the list of check-in patients. Here the complete list of patients who has checked into your hospital or clinic will be displayed here, so that you can easily manage the list of patients who actually checked in, and you can provide the treatment accordingly, so that you can provide the treatment accordingly. Here the complete list of patients who has checked into your hospital or clinic will be displayed here, so that it will be a sorted data, to which will make it easier for you to provide the facilities and the treatment accordingly. Here you will be able to see the complete list of patients who has checked into your hospital or clinics. So it will be actually sorted data for you, so that you can have a filtered list of checked in patients, okay, so that you can provide your treatment, you can start the services immediately. Now here you will be able to see the list of reminders that has been received by you. It can be the reminder related to the system or the provider or the patient, that the patient has been checked in and checked out. If the information is received by the provider, then also it will be displayed here. So that was a complete interface for the receptionist. That a receptionist has been provided the limited access, whereas for the provider we have actually catered him with the multiple modules, just to mm, you know that was all for the receptionist interface. We have provided receptionist a limited access for the modules, whereas provider will have more access to different modules. So what I'm going to do is I'm just going to log out from here and log in with the provider's account. So similar to the receptionist account, we have the appointment list in the dashboard, and then we have the same options like the checked in status for him, and the vitals and allergies, and the charting. It's similar to to the earlier charting that we have already seen in the receptionist account. Mhm. So I guess scheduling is again the same, and the patient list we have the same as we have seen in the receptionist. And then the extra module which we are actually offering here is the pairs. In pairs, you can view all of the pairs and insurance providers in this list. If you want to add a new pair, you can add it from here. You can make him as primary provider or a secondary, and then you can select the type of the insurance that the payer is actually offering, and the billing method. If you want to add a new payer, you can add it from here. These are the list of payers, and you can add it. So these are the list of all of the payers. You can add it from here. So this is basically the list of all of the payers who are actually associated to you. You can just have information like billing method they are actually offering, insurance type, and you can edit the information. Then you can remove it. You can change the type of payer class such as secondary or primary. If you want to change any of the information for that particular patient, you can make it from here. You can change the actually insurance type and the billing method they are currently using. So next thing is like a staff. As a provider, I need to maintain my staff, and I can do it from here. You will be you can have a view of complete list of staff members who are working under you. Again, you can have a rules of them, like what role they are playing in your hospital, such as practice admin, provider, nurses, receptionists, and that's it. You can just change the status of their account from active to deactivate. If you want to add a new staff, you can do it from here by providing all of the informations like username and their mobile number, and then uploading their profile picture, and then you can just click on the user role they will be playing in the system. Then we have the locations part. Location part is like if a patient has been like entered into your hospital but the service will be provided from the else, then you can you know add a location from here, and then once the patient is entering, you can just select the location from the given list. So here you can like have a view of all of the practices or providers name who will be providing the service, and then you can have the location name and the address of it, and you can have the NPN number for the same. Here you can edit the information for a location. Then we have a claim log. Within the claim log, you will be able to see the complete list of patients and the claims that has been submitted by you. This process comes once the charge entry has been filled and you have submitted it for claiming. So here you will be able to see the complete list and their status like the submitted amount and the received amount and the ICD time that we have used while entering the charges, and if it's submitted or not, you can see it from here. And now we have the settings part. Here you can view the practice logo, and then you can change your password, and then you can have a work schedule, like from what time to what time you will be working, and from and from where from when you won't be able to provide your services. And then the activity log, that whatever the activity has been happening in your account will be displayed here. Once it's logged in, you can upload the documents related to you. Then the service code settings. mm, Basically, service code settings are those which actually you are using while entering the charges for a particular patient, such as the ICD codes that we are using in charge entry sheets. So from here you can add it or remove it. And then we have the pre-authorization alert setting. You can change the settings from here. You can change the level of it, and then you can turn it on and off. Then we have a quick appointments option. Like if you want to add or register a patient, if it's an emergency part, then you can add it from here by providing the basic details of it. Then we have the to-do list, that whatever the tasks you have to perform in the system will be displayed here. And then these are the list of reminders similar to receptionist account. In the alerts history, whatever the alerts we have received through the system will be displayed here. And the list of staffs and the list of staff who are working under you. So this was a complete interface of a provider's account. We have already seen the receptionist account. So I guess if you have any queries regarding these, so this was the complete walkthrough of our DS4U EMR system. Hope it suffices the need of your requirement. Thank you.